The healthcare system is broken. It absolutely sucks. Let me explain. 大家好，我是 Suran 在中国. Hey everyone, it's Suran in China. How y'all doing today? I hope you're having a fantastic day. Today I want to talk about a subject which I know quite a bit about, and that is healthcare, or the lack thereof. Let me explain. Now, I have experienced the healthcare system in Canada for most of my life, and also the healthcare system in China for a very large portion of my adult life. And you will be surprised to find which one I think is better. But first, let's talk about Canada and the misconceptions that not only people around the world have about Canada, but Canadians themselves. Many people think that the healthcare system in Canada is wonderful. They have the best doctors, the best treatments, and it is free. Now, I use the air quotes because the Canadian healthcare system is famously known to be free, but I can tell you for a fact it is not. I know this because a couple years ago I took a tax preparer's course, not to get a job doing your income tax filing for you, but to be able to better understand how income tax in Canada worked and why Canadians are being charged as much as they are. Healthcare is one of those costs that is hidden in your tax return that you pay hundreds, if not thousands of dollars for every single year. But they don't list it openly saying, oh, you paid this much this year for healthcare. No, it's hidden way, way down in the small print. You have to really search and look for this to see just exactly how much you are paying. If you're a single person, you're paying this amount. If you're a family, you're paying this amount. And it is ridiculous. So when people say, oh, Canada has free healthcare, no, they don't. They're just not telling you how much you are paying for that healthcare. So it's definitely not free. And even if it were free, you get what you pay for. I'm going to use myself as an example. I have a hernia. I've had this hernia for over 5 years. Now, in Canada, I moved across the country from Alberta to Ontario because of my work to open up a new store for the boss. Great. It was a good time. It was exciting. However, when I went to go find a new family doctor, that's when the problem started. And this was before COVID. Family doctors were simply not accepting new patients. Period. I even went to a government registry, an agency designed to help put people together with family doctors, and every year, not every month, every year for the past 5 years, I have received a notice saying, we're sorry, we still can't find you a family doctor. But if you've found one in the meantime, please let us know. And let me tell you, I applied for every family doctor in my neighborhood. Then I applied for every family doctor in several neighborhoods. Then I applied for just random doctors in the city. Then I started looking to smaller communities and smaller towns outside of my city, hours of drives away, just to be able to see a doctor. No. The only option I was left with was walk-in clinics, or these, I guess, generic clinics where in some cases you can make an appointment, but the 2 or 3 times that I tried that route, I waited 2 to 3 or more hours past my scheduled appointment to even see a doctor. And of course, how am I supposed to work? How am I supposed to book time off of work when I can't even see a doctor the scheduled time I'm supposed to see them? Long story short, I never did get my surgery. I never even once got to see a doctor. The one time I got into the medical clinic to see a doctor, I said, well, I need a referral to a surgeon. You don't have to do anything. No actual physical work. You don't need to touch me. All you need to do is fill out a piece of paper referring me to a surgeon. And I have some marks on my body that I'd like a dermatologist to take a look at. So I need a referral for that. 5 minutes worth of work to fill out two pieces of paper, not even fill out, I mean, on the computer. And the doctor said no. One issue per visit. So he refused to fill me out a referral for a dermatologist and a referral for a surgeon. If I wanted to have one or the other, I would have to come back on another day, book another appointment weeks or months into the future, wait hours and hours again to see a doctor simply for two pieces of paper. Why do I live in China? Let me tell you. Now, a lot of people give China a hard time about how difficult it is to live here. But let me show you the process that I went through recently, just a couple of weeks ago, because I had an issue that I wanted to talk to a doctor about. So I went to the traditional medicine hospital nearby my home, and I've known people that have had treatment there. They've all said it's very, very wonderful. My wife has had treatment there. She said it was great. So I thought, let's give it a go and see exactly how this is going to work out. So we booked an appointment online for the next day, not 2 weeks, 3 weeks, 2 months in the future, the next day at 10 o'clock in the morning. And this is what happened. All right, so this is the front of the hospital, and as you can see, it is quite busy with a lot of traffic, a lot of people. So it's not a slow place. It's not a little countryside hospital. This is a big city hospital. This is the very clean, very well organized reception area inside the hospital. And the way it basically works is you book your appointment online, if it's not an emergency, of course, and you would come over to one of these kiosks. Once you get to the kiosk, you put in your ID card or your number for the appointment. Or in this case, we were using my wife's card since she has social insurance. You plug it in, and it will give you the information about your appointment, where the room is, what doctor you're seeing, where to go within the hospital. You answer a couple quick questions, and you make your payment. Now, the payment, because I don't have coverage, was 50 renminbi. $10. So the wife is entering all the information right now and also making the payment from her social insurance, no cash actually required. And then the machine is going to spit out the information. There it is. Now, from this point, we're going to go upstairs to the fourth floor where this particular doctor's office is. And as you can see, so many people think that China's healthcare system, like everything else in China, is just terrible. It's dirty, it's filthy, the hospitals are not clean, they're not safe. Look at this place. It's beautiful, it's beautifully decorated, it's absolutely spotlessly clean. There is no hassle, there are lots of people to help you, and it's just a very, very easy place to navigate. So we're going to continue making our way up here to the fourth floor. And everything is, I mean, unnecessarily so. Everything is decorated so incredibly nicely. I've never been in a hospital in North America that looked anything like this, right? So we're continuing up. On these placards on the right hand side are little health notices, suggestions to people on how to live a healthy life. And like I said, it is quite busy. It is a weekend, but we thought, well, let's arrive 15 minutes early for the appointment just to make sure we get everything done. So right at this point, we're about 10 minutes early for our appointment with the doctor. And I'll show you how that goes. So we go into the waiting room. Again, we don't need to do anything. Everything has been done through that self-serve kiosk. And the numbers will come up on the screen telling us what room to go to and at one time. Eventually, we got to see the doctor. It took 5 minutes past the scheduled appointment. And within 15 minutes of talking with the doctor and addressing my concerns, we were out the door. He gave us a prescription and said, go downstairs to fill the prescription. That's what the wife is looking at right now. And she's wondering where to go get it. Now, there are some kiosks and places that you would scan the barcode on the prescription and it would tell you where to go. However, in this case, The doctor had done everything for us. The prescription had already been sent to the pharmacy inside the hospital itself. So we just need to technically go find the correct location. And again, there are staff like this young lady here everywhere, with volunteers helping people if they don't understand how to use the kiosks, helping people to get the information they need. And there are other facilities in the hospital too. There are snack shops, there are coffee shops. There's a beautiful outdoor area where people can go if you happen to be a smoker, or if you just want to go outside and get some fresh air to and spend some time with your loved one or a friend who happens to be in the hospital. There are all sorts of fantastic services like this. Now the wife is trying to scan the um, the barcode on our prescription, and the machine is saying no because, like I said, the doctor has already done that. It is already in the system. At this point, all we need to do is go to the right counter and wait for our name to be called, and that's it. So the wife is now figuring this out, and she's like, "Oh, okay, I guess just go over there." So away we go. And again, although busy, still that same sense of cleanliness, organization. There's no garbage all over the floor. There are no people smoking in the hospital. There's not crap everywhere. So this is the counter where we're going to get our prescription picked up. And look at this here, a lovely little coffee bar with fresh fruits, little breads and buns. Outside here is this lovely, lovely looking area where kids are running around, families are hanging out, having a good time. So the wife just asked, and she said, "No, you don't need to do anything. Just sit and we'll call you." So we go and have a seat, and the pharmacists take care of everything for us. Again, I really, really like the decorations here. A little close up of the coffee bar here while we're sitting and waiting. The wait was maybe 5 minutes, um, if not less. Okay, so here's the prescription that we picked up, and we found out after picking it up that my wife's insurance covered the entire cost. That even if it hadn't been covered by her insurance, it would have been a couple of bucks, $2 at best. So there we go. We're finished. We came to the hospital 10 minutes early, and we're out of the hospital 30 minutes later. This is impossible in Canada. There is no way in hell I'm getting into any medical clinic, whether private or public, hospital or actual doctor's office, this quickly and this efficiently. So there you go. That was my visit to the Chinese hospital. I did not have to wait weeks and months for an appointment. I did not have to sit in a waiting room for 2, 3, or 4 hours. And the prescription, even though I don't have coverage, was so inexpensive that even if my wife's social insurance didn't cover it, the entire visit to this doctor to get the health care that I needed would have cost 12 Canadian dollars. So, which healthcare system sounds more broken to you? The free one, where people are literally dying on emergency room floors for lack of doctors, because they spend 17, 18, 20, 24 hours after car accidents, after serious emergencies, to even see emergency healthcare. Or people like myself. I did get, by the way, that appointment for the dermatologist. It took a year, a literal year, to go see the doctor. And when I showed up at the doctor's office on time, early for my appointment, oops, didn't anybody call you? No, the doctor's not here today. He had another appointment. So yeah, no, there's nobody here to see you. We can book you another appointment. We'll rush it this time, so we'll get you maybe in 3 to 6 months. That was my last experience with a medical doctor in Canada, and will very likely be my last experience with the medical system in Canada ever again. Um, Healthcare is broken in Canada. Luckily, I don't live in Canada anymore, and I'm in a place that does value healthcare.